term. In the short term, we have to bring dentists in because the auxiliary dental officers used to deal with children's teeth, and they were specifically for public health programs. So the only other officer that can deal with the children's teeth are dentists. So we need to, in the short term, contract some dentists to come and deal with the children's teeth. The other aspect that the auxiliary dental officer used to deal with was the school community program. And this was where we would go into the schools and we would do a lot of preventative work in terms of, one, teaching the children how to care for their teeth, and two, doing rapid assessments. So we would know what is the level of dental care going on in especially our primary schools. So the dentists will come in and deal with the clinical aspect in the polyclinics, but in terms of the preventative work that has to happen in the schools, we're looking at a community dental educator. And these will be dental assistants that we would train up in order to do the rapid assessments and do the promotion that is necessary. And that is the medium term. In the long term, we are looking to train the dental therapist hygienists that will then take over the role of the auxiliary dental officer so that we wouldn't need the dentist then, we would have the dental therapy hygienists who can take over the care of the children. So in this way, we will tackle both the preventative aspect of the dental program and the clinical aspect. So right now we are in the process of making sure that we have all of the costings correct in the proposal, and we also have the empty posts that would have been occupied by the auxiliary dental officers. We will be able to use those in the costing going forward.
One question before, is there room for volunteerism? I've actually spoken to one dentist who was quite willing and ready to volunteer, but did not get quite a positive response. Is there room for volunteerism? I'm sure the member for Christchurch West would be familiar with dentists who might be willing to volunteer their time.
Yeah, we are very happy with dentists who volunteer once they meet the requirements, one of which would be that, obviously, that they're registered, and that, one, they have their liability insurance.
And I'm sure they would have that if they're practicing in Barbados. The other issue, though, you did mention the therapist hygienist. So where is that training being located?
Right, so the therapy hygienist, that training is being sourced. We know for sure that the training does occur in England, and so that's why it is the long-term approach, because we know we would have to train up those persons, and therapists, hygienists can take up to 4 years to train.
Okay, thank you. And the last question, and it also relates to the same profession. Oral surgery services have always been lacking at the Queen Elizabeth Hospital. What program and policies you have in place from an oral surgical point of view, providing that sort of service in the Queen Elizabeth Hospital?
I will ask the Director of Medical Services of the Queen Elizabeth Hospital to address this one.
Good afternoon, Madam Chair. Thank you, Minister. We have no formal program for oral surgery at the Queen Elizabeth Hospital. What we do have is an occasional visiting surgeon in the practice of oral surgery. We also have a full-fledged plastic surgeon with maxillofacial training and a full ENT department. And the ENT department really coordinates the requests and the referral to any oral surgeon in the region or even from overseas, as we may need from time to time.
Okay, thank you.
Honourable Member for St. Michael's South Central.
Thank you very much, Madam Chair. Now, Minister and team, last week, the Cabinet of Barbados considered the population situational analysis that was commissioned by the government. We asked a population commission that we put together some months ago to look at some of the population trends and to be able to guide us as a country, to be able to lead us in a conversation about what are some of the population trends that are going to affect how we need to craft policy. What the commission found is quite sobering. And as I mentioned, they will be coming to the country to be able to have that conversation and consult with Barbadians about what are some of the things that need to be done. We know, for example, that we dropped below replacement rate of the population back in 1980. We know, for example, based on that study, that if we had had replacement rates, the population of Barbados would now be at about 360,000. We know that the healthcare costs associated with what we call this graying population are expected to double in the next medium-term period. I want to ask, therefore, two things. One is, what are the plans that the Ministry of Health and Wellness has with respect to geriatric care? And the second is, some time ago, we also had extensive discussions with your ministry about a healthcare financing model. What is being proposed, especially in the context of the Barbados Economic Recovery and Transformation Plan, to really come up with a sustainable way of financing healthcare, bearing in mind that it's not just the Queen Elizabeth Hospital and polyclinics, but Minister, where you and I happen to be neighbors, we have essentially an entire medical care complex that spans the Belleville area and the Greater Bridgetown area. So first, what are the plans for geriatric care, given the graying population in Barbados? And two, where are we with that new healthcare financing model that we had discussed?
Thank you, Honorable Member. Dealing with the plans for geriatric care, first of all, let me say that from within the first 2 months or so, having assumed the responsibility for health and wellness, I recognize quite clearly that we were experiencing a problem in terms of geriatric care, and that this problem was likely to get worse before it got better. And that I came to that view because, first of all, Barbados being an aging population and an aging society, and one visit, for example, to the St. Michael District Hospital, known as the Geriatric Hospital, which I found out during that visit that we actually had about 13 centenarians in that one hospital. And when I looked at the facilities that we have for providing geriatric health care and the numbers of persons who have been requesting for relatives and so on to be able to access that care, to be admitted to the geriatric hospital, I recognize that the demand for geriatric care was greater than the capacity to deliver at the public health service level. But we have strategized this, and one of the things that we've tried to do is to involve the alternative health care persons to a greater extent within the delivery of that health care. And then a mandate that was given by the Prime Minister to go into community health care. That program is being looked at the moment with the desire to be able to train persons from within communities. And we know in Barbados that there are quite a few persons who have successfully completed the Care the Elderly program. So with a special program for such persons and others, then we would be in a position to be able to get persons to remain at home, this is elderly persons, and to be cared for within their own homes or within the communities, so that there's a level of comfort. And we believe that that is probably the least expensive method in terms of providing that health care. Additionally, the government of Barbados is seriously considering and looking at plans to build a new geriatric hospital in this country. And I think that that is going to go a long way towards redressing some of the issues that we have. But I will hand over now to the consultant gerontologist, within the geriatric system, Dr. Ramsey, so that he can further expand.
Good afternoon. To the chair, I must apologize. I just walked in on the discussion, so I wasn't quite sure of the
Plans for geriatric.
Okay, the plans for geriatric care. Yeah, sure.
Just did though.
Yes.
Sorry, Minister or Dr. Ramsey, please introduce yourself formally for purposes of records.
Sorry, my name is Ambrose Ramsey. I am consultant geriatrician, Ministry of Health and Geriatric Hospitals.
Yes, to continue with what I was saying, I believe in every situation that one should look to see how a particular situation can benefit a country. And we're always told that we should definitely use the things that make us strong, the things that we are renowned for, to the benefit of the country. Barbados being one, perhaps I think the #2 country in the world per capita with aging population, Barbados being a tourism destination of class, I think an excellent country. People love Barbados. I have this vision of making Barbados the hub for elderly tourism in this country once we have the facilities to do so. And I believe, in the region, sorry. And I believe that geriatric care, especially with a new geriatric hospital, engaging communities and community health care for senior citizens, and in collaboration with the Ministry with responsibility for elderly care and the Ministry of Tourism, I believe that we can create the environment in Barbados for the delivery of health care to geriatric persons. The second question has to do with healthcare financing model. Yes, we have embarked on an initiative that is aimed at recommending to Cabinet a new model for the healthcare financing in Barbados. And the first aspect of that initiative is in progress, which is the costing study within all of the healthcare institutions that would provide the platform for this initiative to really come to fruition. And I would now invite the Healthcare Commissioner, Mr. Danny Gill, to be able to expand on this.
Thank you, Minister. Madam Chair, my name is Danny Gill. I am the Health Care Financing Commissioner. In terms of the question from the member for St. Michael's South Central, before we can look at the model that we are looking at, we have a model in terms of what we want to do with healthcare financing. But before we can decide on exactly where we are going to that, there are things we had to put in place. First of all, we had to do an expenditure model of how much we do spend on health in Barbados. That figure is about $734 million. Then we are now working with the University of the West Indies Health Economics Unit, and basically what we are doing, we are costing the health services in Barbados. They have returned 2 reports so far. The first report was on QEH. The other report was on the polyclinics, the 9 polyclinics. By March 15th or the 20th, I think it's either the 15th or the 20th, we're going to get the other reports on all of the other programs and services within health. So by March 31st, we would have a set of reports that tells us exactly what it takes to run all the facilities and all of the programs. We also would have presented a cabinet paper on 2 models. One was based on the Canadian model, which is mainly national health insurance, and the other model was the Swiss model, which is basically health insurance. For us to then build out those, we need then to have in place the expenditure model, the costing model, and then we would also need to look at what is going on in our population. So we may have to use some of the work that was done for the national insurance scheme. Basically, we have most of the elements in place, and at least by year end, we should be able to, not year end, but at least in the next couple of months, we'll be able to say exactly where we are going with it.
Madam Chair, just a quick follow-up. Thank you, Mr. Gill, for that update. It seems to me, though, that the issue of providing, accounting for all the costs and therefore being able to fill what any of the financing gaps are quite critical. I know that there is some engagement through philanthropic exercises and other kinds of initiatives, but if there's one sector that is likely to attract the interest of charitable organizations worldwide and other kinds of institutions, it is the healthcare sector in a developing nation like Barbados. So I'm hoping to hear, and I noticed the executive chair has taken the mic, but I'm hoping to hear a bit more specificity in terms of the plans for philanthropic engagement, even concessionary funding that the sector may attract, and also with respect to some specific inputs that the hospital has or that healthcare has. Now, over the last couple weeks, and I do want to be able to applaud the ministry on the immense work that you've undertaken and the improvements in service that we have seen in the last 21 months. I think many Barbadians have noticed it. But the thing about the QEH and health services is that if you're not on it every day, there are things that may slip. And certainly in the last couple weeks, what we've been hearing about is some issue with respect to the availability of beds, especially for patients that are coming through your triage system, coming through A&E, and being able to be allocated beds. We have been hearing, and I'd love to hear you address this so that you can put to rest if it is not true, but we've been hearing about people who have had to sit in chairs for some time before beds have been allocated. And so I think that there's some urgency, and I understand all of the things that you're dealing with, that you're battling with, and all of the improvements that you've made, notwithstanding the circumstances, and it is to be applauded. But at the same time, when it comes to healthcare, regrettably, we don't have much room for self-congratulation. We have to keep pressing on. So I would want to hear some of the specific partnerships, private sector partnerships, philanthropic partnerships that you're pursuing, and also how these relate to some of the specific inputs of equipment and other capital inputs, other equipment inputs that you might have right now with respect to the QEH.
Before you invite the executive chair of the QEH to address those issues, I think I need to say that the Ministry of Health and Wellness has embarked on a program which is part and parcel of the Regathering 2020. Regathering 2020, all the major donations or contributions or give back in relation to 2020 have been earmarked for the Hospitals of Barbados project, which includes all of the hospitals, Queen Elizabeth, psychiatric and district hospitals. And we in the Ministry of Health and Wellness, there's a committee which is monitoring that. We have issued we have posted a prospectus, which is online as well, and that gives clear indications as to those persons who would wish to contribute, what it is we are looking for, and how they can get it to us. And we've already started to see the benefits of this initiative. St. Lucie District Hospital and Elaine Scanterbury Center would have benefited from the St. Lucie Initiative 2020 regathering. And there are some other institutions within the Ministry of Health and Wellness that have started to benefit from various contributions and donations of persons. So that is very much in train. But I know that the Queen Elizabeth Hospital has been doing that for a long time, and I will now ask the Executive Chair to address it from a QEH perspective.
Thank you. Thank you so much, Minister Cattle. You are correct that in order to meet the gap, the Queen Elizabeth Hospital, like most hospitals globally, will have to use philanthropy as a major source. And in our planning and budgeting for the upcoming financial year, we've projected to use philanthropy to mobilize about $1 million in our upcoming planning. How we are addressing this specifically, we have an equipment prospectus which we put out in 2018, and we're planning that the emphasis on that prospectus was around central sterilization. We are preparing a second equipment prospectus, and we have been in the process of circulating an equipment list to the ambassadors, in Canada, the United States, in Canada, Washington, D.C., and Miami specifically. So they have been working with us very directly, those ambassadors, in speaking to the diaspora community to really establish and respond to our specific needs. We also have been having key partners come on board. You've heard recently of the Sick Kids Initiative, which will be bringing approximately $30 million between the Queen Elizabeth Hospital and the primary health care system. That is built around the model of technical assistance, as well as the provision of some infrastructure support. We have put to the Maria Holder Foundation, and we're awaiting further word on that, a proposal to build a pediatric wing onto the hospital to complement this pediatric initiative, and encase within that pediatric wing an ambulatory care facility so that we can do an increasing number of same-day procedures. We also have been talking to the Lionel Clara Foundation, and we've put a prospectus out to them. The areas they're focused on giving charitable giving to will be disaster management and disaster preparedness, as well as cancer care. So we've put to them a proposal for helping us with the area of building out and headquarters for the ambulance service, for providing shutters across the entire facility in the case of emergency, and for other initiatives around disaster preparedness. In the area of cancer, we're looking for their support in the area of oncology treatment and strengthening our provision of services, and the area of providing a linear accelerator supporting us to build this has also attracted their attention. So I wanted to give that assurance that we are using philanthropy as a major initiative. We have a strategy we're rolling out, and we're getting the necessary responses. A key initiative we want to focus the local community on is painting our facility. Many of you that have passed the Martindale's Road Constitution area from all angles can see the state of the facility, and it really does not have the appeal that is necessary. The excellence of the exterior really doesn't represent the excellence that goes on within the building. So we have been putting out for philanthropic interest the area of getting various partners to support us to have this hospital completely painted over and really beautified both internally and externally. You're also correct, Minister Cattle. through you, Chair, that the area of financing, I'm very appreciative of the fact that the Minister duly recognized that the provision of tertiary services doesn't just take place within the precincts and walls of the Queen Elizabeth Hospital, that the private sector, particularly in the Belleville area, have made substantial investments. What we're doing as an institution, with the support of the Commissioner for Health Financing, is the Health Economics Unit has completed a study, or is near completion, which tells us the cost of services of many of the procedures that we're currently doing at the hospital. If we can firmly establish what those costs are, we're going to be entering into a situation where we'll be talking to the private sector, looking at the possibilities of contracting out or purchasing services that can be less costly to taxpayers. Our assessment is that taxpayers are not so much interested in where they get the services, but that the services continue to be free at the point of delivery. And if we can partner with the private sector, it does two things. It creates and spurs economic growth in the private sector. A country grows not so much by public sector expansion, but by private sector growth. So it grows the private sector economy, and people are able to get the services. So we're looking to see where we can outsource services at less cost to taxpayers with the private sector. We also recognize, however, that model also has some challenges in that we are teaching hospital. So we need to do this outsourcing model, and thank you for the notice on the time, cognizant that it also has to make allowances for our students to be trained across both the public and private sector, and we'll have to have those discussions with the University of the West Indies as to how we can facilitate it. But growth in the health sector will necessarily take a public and private partnership approach, utilizing a hub and spoke type initiative where the hospital is the center and we're engaging with partners outside.
Honourable Member for Christchurch East.
Madam Chair, thank you. Minister, I just want to commend you and your team for an excellent job. I almost get tired of saying it, but I can't because it feels really good to actually commend the government on something. So congratulations to you and your team for the turnaround in the hospital. The Best Dos Santos lab. I first became aware of that when we put some solar panels on the roof and tried to make you self-sufficient with electricity. But I think a lot of Barbadians don't actually know what the lab is and what it does. Some would have heard that we now have coronavirus testing facilities, and that the lab is one of the most recognized labs in the entire Caribbean. But perhaps if you can enlighten us as to what are your plans for the lab over the next year, what is it equipped to do, what is the role of the lab in this current, I don't want to say crisis because we don't have a crisis yet, but with the anticipated action that will come eventually. So I just would like to know what is the plan for the lab, how equipped is the lab to deal with the testing for coronavirus, and just what else does it do so Barbadians can actually know that we have a world-class lab and have some idea what goes on there.
Thank you, Honorable Member, for your questions. Like you and like most Barbadians, before I became Minister of Health and Wellness, I did not know anything about the Best Dos Santos lab. But when I visited the lab, I was amazed and impressed at what I saw. The equipment, and quality equipment, the level of training of the staff, what it is that they actually do there, and then the possibilities for further development of that lab, and also the revenue earning capacity of the Best Dos Santos lab. And I have seen over the last 18 months the importance of having a lab like the one we have at Best Dos Santos in this country, not only because of the threat of corona, but we've had other public health issues which the lab had to be pressed into service to be able to help us to resolve. And I'm really, really happy at the standard and the commitment and dedication of the staff of the Best Dos Santos Lab. And so it is my pleasure to invite Ms. Sanjay Beckles, who is responsible for the lab, to be able to answer those questions.
Good afternoon. My name is Sanjay Beckles. I'm currently acting director for the Best Dos Santos Public Health Laboratory. Thank you for your question. So based in terms of what our lab actually does at this point in time, we are the only public health lab that exists currently here in Barbados. We do majority of the testing for the public clinics, all of the polyclinics. That kind of testing include, we would test, we would do research on swabs, we would test urines, we do a variety of blood tests for STI monitoring such as syphilis. We also do such herpes, simplex virus, human papilloma virus, chlamydia and gonorrhea. So we do quite a lot of investigations on the samples that we do receive from the polyclinics. Also, we also work with the Environmental Protection Department and the Barbados Water Authority in terms of monitoring the water quality of samples coming from throughout the island, including pools, standpipes, the reservoirs, etc. So we do quite a range of testing. We also do molecular diagnostics where we monitor things like HIV, DNA PCR, not only for Barbados. We have been doing some testing for other islands of the region, for the OACS islands, for quite a few years before the Best Dos Santos Public Health Lab is actually an amalgamation of 3 different labs: the Lady Mead Reference Unit Laboratory, the Leptospira Laboratory, and the Public Health Lab. And so the LRU lab at that time when we were separate was doing testing for the OACS in terms of DNA PCR, which is the early infant diagnosis of HIV. We do resistance testing for HIV as well, and we have been doing testing for places like Suriname, Guyana, and some of the OACS islands as well. So we actually have quite a range of services that we offer. With respect to the coronavirus, we are one of the few countries within the region, immediate English-speaking region, that are doing the testing. They include Jamaica, Trinidad, Dominica, Guyana. So we are one of those persons that have been trained by PAHO, WHO as well. And so we are doing the coronavirus testing there. And in terms of our capacity, we are actually receiving the reagents from PAHO at this point in time. We've also tried to order some through the CDC website, influenza resource reagents. We actually, in terms of our capacity, we actually have 5 persons that were trained, and we have 3 machines that could actually run. So we do have the possibility that if one machine goes down, we have backup machines that we can use. So I think we are pretty well off in terms of our capacity for testing at this point in time.
I don't want to ask you too direct a question, but what is the turnaround time on a test for the coronavirus?
At this point in time, it's 4 hours, but of course that is only because we only have very few samples coming in. I imagine that it will hit shores of Barbados at some point, and then obviously there will be a delay in terms of the numbers of samples coming in, actually processing them and actually producing a result. But at this point in time, with the few samples that we do have coming in, it's 4 hours.
And are you comfortable that you have enough resources to deal with the expected testing as time progresses?
In terms of reagents, no, because we really don't know how it will balloon. The capacity that we have at this point in time, we can probably do another 80 tests. PAHO has indicated that they will supply reagents to do another 300 to 400 tests, but is that enough? Maybe not. So we are actually in the process of trying to procure more reagents as well and see if PAHO can actually offer more assistance.
And I think, Madam Chair, that I need to add there that the government of Barbados, through the Ministry of Health and Wellness, is actually at the moment trying to source additional testing kits that we will purchase, because we recognize that the government has a responsibility to the citizens of this country to try to get as many kits available for use in Barbados in the event that we need to have those kits.
Minister, I believe everybody understands and appreciates that there's probably a worldwide shortage of this with what's going on in the world now, but I'm comfortable you're doing your best. Thank you.
Honorable Leader of the Opposition.
We are being, Minister and team, we're being fairly well reassured of our capacity to test. The availability of testing kits in quantity is quite a controversial subject in other parts of the world. But we're being reassured of our ability to test, our capacity to test. My concern is in the event that the virus comes to Barbados, the rate of spread seems to be fairly pacey, quick in other parts of the world. Do we have the capacity to respond to and treat the number of infected persons? I think I heard that the Enmores is a 6-bed, 7-bed, 9-bed facility. St. Lucie is being prepared. St. Lucie District Hospital is being prepared as a quarantine center. And the St. Lucie Naval Base, potentially refurbished quarantine center. But actual intensive care treatment center, as is the case with the Enmore facility. In the event that the virus comes here and there is a quick spread, my concern will be our capacity then to respond to that.
Thank you, Honorable Member. We too recognize the need to increase the capacity, the current capacity from the 6-bed center that we have established at Enmore. And so there are two things that we are working on at this point in time. First of all, the Harrison Point facility is expected to be a dual facility in that it will house a quarantine center, but also an isolation center, which would give greater capacity to the center at Enmore. And that isolation center, I believe, we are looking at about a 31-bed facility. And in addition to that, we have also a field medical hospital, which is being managed by the Barbados Defense Force, but it involves other sectors of society in terms of human resources. And that facility, at the moment, we are looking at being able to provide some additional capacity, somewhere between 20 to 40 beds if required, that will then give us the capacity that we think that we can manage with at this point in time. In terms of the spread of the disease and how we will respond to it, I'll invite the Acting Chief Medical Officer, Dr. Anton Best, to speak.
Good afternoon, Madam Speaker. If I may respond to the queries by adding to what the Minister of Health has just said. At this current juncture, the majority of countries in the world have COVID-19. In fact, I believe the last count on the WHO website was about 101 as of yesterday. It may have increased by today. We have many examples to draw on where countries have COVID-19 cases, but the spread has been curtailed or stopped. So it is possible to contain the spread of this virus, and that's the one thing that we need to concentrate on. So in terms of our strategies, we're looking at surveillance, we're looking at quarantine for persons who are deemed to be at high risk based on their history of travel. But the moment we detect that very first case, we have to put our energies and efforts into containment. So while we're expecting the worst case scenario, we're preparing as best as possible, and we do not anticipate that there will be such a large scale spread if we do what we're supposed to do in terms of containment. Many countries who have had single digits cases more than 2 weeks ago have remained at that level because containment works. If we were talking about a flu pandemic, containment is almost not an option because it's just not possible to contain the flu in the way that it's possible to contain COVID-19. So just to add and to repeat some of what the Minister said, we are looking to enhance the capacity at the Ministry of Health facilities. We're also looking to partner with private sector organizations in terms of identifying what the deficits are in terms of training needs, in terms of technical requirements such as PPE, in addition to the training, and to be able to funnel people to certain sites if they believe that they have possible COVID-19 based on their symptoms.
Sorry, Dr. Bess. It sounds like we're ready for the quarantine. What about the supportive care? Worst case scenario, what about if it hits somewhere like, for instance, the geriatric hospital? We just seen something on the news with respect to it showing up in a nursing home in the States. What about contingency plans for those? Do we have enough respirators? Do we have enough supportive care equipment that we can anticipate?
So we have considered, we actually do have a very clear plan as to what to do to protect the elderly. We recognize that the elderly population is the most vulnerable population in other jurisdictions. And in fact, it was just yesterday that we developed that plan of action as to what to do. I'm not at liberty to go into details, but I would like to respond by saying we do have a plan of action that's being implemented as of today in terms of protecting that particular population.
Okay, and the other part with respect to the supportive care, I know the hospital as it stands is possibly short on equipment with respect to that. How are we handling that? Are we bringing in more equipment soon?
Yeah, so we have identified all of our equipment needs. So at the existing facilities, as well as the ones that will come on stream in very short order. Okay. And that list has already been costed, and we are already starting the process of procuring the equipment that is required.
Wonderful. Honorable
Thank you, Madam Chair. This was not one of my questions, but why would you not be at liberty to give us details on a plan for the care of the elderly in case we have a problem?
Thank you, honorable member. Let me say that the plan is not a secret plan, but the care of the elderly goes beyond the Ministry of Health and Wellness. It goes beyond health care. And we have completed our aspect of it in terms of health care. But we are now scheduled to have a meeting with the ministry with responsibility for elderly care so that we can then fashion out what we will then call the national plan for the elderly in relation to COVID-19.
I agree with you, Madam Chair. I can read your mind. We don't have a plan. We have an aspect of a plan which yesterday was formalized and developed by the Ministry of Health. But the plan would be incomplete without reference to other ministries.
Honourable member, I'm sure you would recognize and understand that since the first week of January, that the Ministry of Health and Wellness has been doing its work. It is a work in motion because COVID is something that is not static. Things change and so on. And we have a process which we follow. We start with the Ministry of Health and Wellness, which is our direct responsibility. Then we engage those stakeholders that we need to engage, and then the draft plan, and that's any plan, then has to go to Cabinet for Cabinet to give its blessings to the plan, because some of the plans obviously would involve finance and other things, and that is the process that we've been using. So it is a work in progress, but we've done most of the work that is required from a health perspective.
It's very serious, and I'm very serious. And I don't know how the prison got into this. So a professional medical person comes here before the Parliament and says, in response to a query from the chairman, expressing concern as to what do we do in the event that this thing spreads among our geriatric institutions. And a medical professional responds by saying there's a plan, but I'm not at liberty to disclose, and I can't ask why not.
On a point of order, Madam Chair.
Go ahead.
I believe that the question has been stated, the question has been asked, the question has been answered. I am not sure, and you will have to guide us, Madam Chair, whether it is within the rules of this House to continue to restate questions that the minister and his team have already answered. I will be guided by you, Madam Chair.
I would not even respond to that. That's totally out of place and out of order. Absolutely. But, Madam Chair, no, I'm not finished. I'm still waiting for a response to my query. Well, what is the plan? The Ministry of Health has a plan. What is the plan?
Let me make it very clear to the honorable member and to all members of the chamber. There's a process which this ministry and this minister have been following. Only this morning, yes, we had a meeting. We all know, for example, with the National Disaster Response Plan, that plan is developed during a period of time, and that the plan is improved. If there are any gaps in the plan, that there's continuous development of the plan. In relation to any COVID plan, and I said it from the first 2 or 3 briefing sessions that I had, that it was a work in progress, but we had to hit the ground running because COVID was already in progress, and we were developing as we go along. And in this particular case with the elderly, we've been doing a lot of work on it within the Ministry of Health and Wellness. We know what we will do in relation to the safety of the healthcare facilities for the elderly, but the plan for the elderly is part of a national pandemic plan, and that plan at the moment has not yet been approved. We know exactly what to do if something happens, and we will act in accordance with those plans and with accordance with our expertise and experience. But in terms of making the plan public, that will come in due course, and it will be very soon.
Any further questions?
Thank you, ma'am. Some would suggest that in Barbados today, what is occurring is a perfect storm. We have an aging population, that's one. We have an increasing incidence of chronic illnesses, that's 2. 3, we have a disinclination or an inability on the part of perhaps the weaker economic elements to seek for primary care because of the prohibitive costs. That's not a reflection on the medical profession. That is a reflection on the austerity of the moment and the level of economic distress that obtains. So the cost is seen by many to be prohibitive. They put off going to the doctor until it's too late. You end up with a bigger problem. There's a power of advertising that drives our lifestyle. Number 5, we have a more sedentary lifestyle at the moment. A lot of practices that we ought to discourage ourselves from. There's a declining capacity of the state to fully finance or properly finance health care. That, to my mind, is a perfect storm. What indicators, honorable friend, can you point us to in the estimates that reflect that there's an understanding of this and a planned strategic response to this? And do you think that we are at the stage where we need a special dispensation in healthcare? And should there be a national platform for dialogue on health-related issues in Barbados as the situation stands now?
Thank you, honorable member. I think I will explain to the honorable member exactly how we have been weathering that storm and how we will continue to weather the storm going forward. In terms of primary health care, I am certain that I said during the last sitting of this House that we have seen an increase in the number of persons utilizing the polyclinic in the thousands. I also indicated that the 24-hour service alone was averaging about 3,500 visits per month, and that is for the first 6 months. With January registering about 4,130 visits. I would have indicated also that the government of Barbados had placed upfront $10 million, I believe it was, for the Accident and Emergency Department, to refurbish the Accident and Emergency Department. We would have received, or it is being considered at the moment, is being looked at for the Ministry of Health and Wellness to be able to obtain some capital equipment for the polyclinics and hospitals. And in fact, that has been promised by the Ministry of Finance, and we expect that that will happen this year. The Queen Elizabeth Hospital, I think that's about $30 million in capital equipment, and that has not happened for at least a decade. In addition to that, funds have been placed at the disposal of the Queen Elizabeth Hospital from the health services contribution, and it is anticipated, based on the performance of the health services contribution, that the QEH should get about $64 million for the next financial year. When we look at those, and we look at what we've been able to obtain through philanthropy, for example, the Psychiatric Hospital and the Thrive Family Center, as a result of the efforts of Sandy Lane Trust, I think that the Ministry of Health and Wellness has been doing quite well. But it is always a challenge, because healthcare is not a static thing. People will get sick. We have to deal with various things that might not have been planned for example, like COVID. But I think that the government of Barbados has demonstrated beyond a shadow of a doubt that it is willing and will put at the disposal not only of the Ministry of Health and Wellness, but any ministry in this country where there's an emergency situation, where there's a challenge. The government has clearly demonstrated that it will put health, education, and law and order at the forefront of any funding that is required. So I have no doubt in my mind that we will be able to get whatever resources we require to weather this storm. As far as the chronic NCDs are concerned, that is a problem. It's a problem for the Caribbean. It's a worldwide problem. And we've taken some steps to be able to deal with that. For example, the establishment of the National Task Force on Wellness and the work that they're doing in terms of the various dimensions of wellness. The community program that was announced by the Prime Minister, where the QEH will be able to hire some persons to go into communities to help persons to manage the NCDs and related issues, diabetes and so forth, to make sure that people are taking care of themselves. I've also mentioned during my introductory remarks last week that we were developing a national nutrition plan to be able to deal with childhood obesity, that we are working in collaboration with other ministries like the Ministry of Education to deal with the situations within the school, the Ministry of Youth, in terms of our young people, and there's also a program even for the elderly. So I am not going to say at all, I would not agree that we have declining capacity. I would say, in fact, that this Ministry of Health and Wellness has been better served by the Ministry of Finance than the previous Ministry of Health under the previous administration. And the last part of this, recognizing that we need to plan for the future, the government directed the population census, which will help us, and also the health care financing model that we are looking at, and the costing study that is in progress. All of that is to enable us to be able to plan better and to be able to contribute to the areas of healthcare financing that we need to contribute towards. And so our primary health care service is well intact, and I would say to anyone that the standard or the state of public health in this country is what is going to serve us in even a time like COVID. And that our public health sector is stronger than most. And that is why I think we've done extremely well so far, and we will continue to do well.
I thank the minister for his, sorry? So you running the chair from over there now? Why don't I stand you? She can count 1, 2, 3. And I'm not asking a further question. I'm simply thanking my honorable friend. No, you must not follow the bad example of the Prime Minister here last week. Now, I was
Honorable members, can we carry on
yes,
with the
ma'am, I
question?
apologize for that, but she
Thank
must
you.
not interfere with me. I was simply saying to my honorable friend here that I was not being critical for the government of not funding health care. In fact, I would readily accept that this government is putting more money into health care than previously. I was simply trying to suggest that the increased level of services which you are now offering, the demands that are placed on our institutions by the health sector itself, the patient world of the health sector, and the fact that you are in an institution which is pretty dated in several respects, and that you are facing a situation where multiple pieces of important equipment are coming to the end of their shelf life and their serviceability, then the government has to be able to find the money to do all of that. And it is a stretch to government. That's all I'm saying. Not criticizing you for the level of spend. I thank you for your response.
And no, I think I need just to add this part, because I'm not saying that you're criticizing, but I was just reinforcing what I needed to reinforce, and to say that the government has already started the process of funding the money, the sums, 30 million in relation to the QAH to replace aging equipment or aged equipment, and about 10 million for the polyclinics and the district hospitals, psychiatric hospital.
Thank you. Honorable member for St. George South.
Thank you, Madam Chair. I have been listening to the quizzing by the member for St. Michael West, and he understands very well. When we started to prepare our manifesto, it was not in the form that it is right now, and it never took a day. Anyhow, me being up next bear no difference to what I have to say.
Sorry. Honorable member for South Central, you were saying something? Okay, continue, honorable member for St.
Thank you, Madam Chair. And I will end off by saying we took a little while to prepare our manifesto, but we had a plan in place, and that was the final result. But my question, Madam Chair, goes to the QAH. And again, the quizzing of the QAH, I would like to hear from the minister, or through the minister, he can direct the question to whoever. What are the plans for the year 2020-21 for the Queen Elizabeth Hospital? We've been hearing all the criticism and the comments, but I would like to hear the plans for the QAH for the year 2020-2021.
I'll invite the executive chair to respond.
Thank you, Madam Chair. Thank you, Honorable Member for St. George South. The Queen Elizabeth Hospital has been allocated $116 million from the Consolidated Fund, and is anticipated a further $64 million from the health levy. And I'll quickly itemize, I understand now the three-minute time limit. What it is we're planning to do over the next financial year. The first thing is that we're mounting a Patient First campaign that will really see us improve and upgrade the quality of experiences that patients have at the hospital. This includes waiting times in the accident and emergency. We've already introduced over the last week a nurse triage center. So when you enter the accident and emergency room, the first person you meet is a healthcare professional. We're doing rounding and improved discharge planning. So an entire campaign around the patient experience. Secondly, we recognize we have the opportunity to do an infrastructure upgrade to the hospital. For this, we will be upgrading the front entrance, building out to improve the security, building out the accident and emergency room, remediating the lab premises, which are old and termite-eaten, expanding the pharmacy oncology. We've been borrowing space from the Best Dos Santos lab to do chemotherapy treatments, and that will end within a few months. And we'll be improving the stairs and other infrastructure to better improve the conditions of work for staff and patients. Thirdly, we are mounting a project cleanup campaign. We're in the process of cleaning up both inside and outside of the hospital. Key to this campaign is also securing the premises. We have been experiencing an increased level of crime, and we also have within the hospital to staff and patients, and we're also grappling with the issue of loss prevention, the loss of vital equipment and supplies. So we've had to strengthen our security through the installation of cameras and other facilities. We also are re-equipping, you've heard already of the $30 million investment that's been made in our equipment. We're also restocking the hospital. We have been affected by stockouts from time to time, and some are because of the position of our local suppliers. We're doing a 3-month top-up of our supplies and really going back to market to improve our tendering processes. HR staff morale at the hospital has been extremely low for many years, and we've had this as a major area of priority. Our junior doctors are going to be seeing an increased focus on how we can provide opportunities for them to grow, how we can reduce the numbers of hours of work. Some are working up to 36 hours on a shift, and we recognize the time has come to institute new modern practices for how we train doctors at the hospital. We also are going to be looking at the issue of posts within the medical fraternity of the hospital and regularizing other positions. We also have a number of initiatives, such as the 6 Kids Initiative to improve pediatric care, our community health workers, and we'll be expanding our advocacy around building out our kidney transplantation program. We need to have more Barbadians aware of the opportunities to give kidneys to relatives so that we can improve the quality of life for persons on dialysis care. And finally, in terms of our key cross-cutting initiatives, we will be over the next year implementing a hospital information system, digitizing all of the processes within the hospital so we can better track our patients and better track our resources and how they're spent. And we'll also be introducing a monitoring and evaluation system. Right now, we're making a lot of decisions not on the basis of adequate information, and it is time that we really use the tremendous amount of data that we're collecting to better inform the decision-making process. We'll also be looking at how we can reduce costs in a number of areas, including the area of being self-sufficient in terms of water in the case of emergency, and in the case of electricity, reducing our electricity bill. We will be looking at revenue generation. We have lost some income as a result of the very progressive CARICOM Nationals policy that the government has introduced to allow persons who are living here to benefit from healthcare treatment. That has resulted in some income loss to the hospital, but we'll be making that income generation up in a number of ways through a car park facility and other initiatives we're expected to increase the amount of resources available to the hospital. I hope, Honorable Chair, that this gives a quick snapshot of some of the key initiatives that we're doing with the budget that we've been allocated over the next financial year.
That's all for you, Honorable Member. Honorable Member for St. John.
Thank you, Madam Chair. I want to join with my colleagues in commending the Minister in terms of the job that he's doing. I was trying to remember, and I asked the honorable member for St. Lucie as well, who was the previous Minister of Health, and he said he thought a man named Stewart. I agree with him. Minister, my question is related to the St. John Polyclinic. A number of my constituents were asking about the status. I'm aware that it will be coming on stream soon as a 24-hour entity, but I also want to know about the status of the gym, because that too is an area that a lot of constituents are asking about in relation to when we can have the gym up and running at that location.
Thank you, honorable member. From a policy perspective, let me reassure you and the good people of St. John that the 24-hour initiative is still on. We have determined that by the 1st of July, that we are going to take will be the start of a two-phase approach to the 24-hour service in St. John. And 1st of July, we will go to extended hours at that polyclinic. And then we will proceed after that, depending on our analysis of the situation as to when we'll go for full 24 hours. The reason why we've decided to do that is because, first of all, when we looked at the data in relation to the 24-hour service at Winston Scott, and we look and we recognize where the persons were coming from. Out of an average, let's say, of about 3,500 visits per month at the 24-hour service at Winston Scott, we were only seeing about 400, 500, 600 persons from the catchment area that we expect that the St. John's Polyclinic would serve. And that was about between 16 to 18% of the visits at the 24-hour service. And out of that, only about 2% of those persons actually are coming from St. John. When we look at the ambulance service, and the intent is to have an ambulance located at that polyclinic, there are not many requests coming from that catchment area for the ambulance service. Now, that is not to say that these services are not in demand. There may be a number of reasons. For example, I will readily admit that until we have enough buses so that my honorable friend from St. Michael West is able then to give us some cross-country routes that will lead to the St. John Polyclinic, that will be an issue. And in terms, sorry? Christchurch West, that will be an issue. And in terms of the ambulance service, it is possible that perhaps the people in that catchment area, because they were not able to access the ambulance service before, probably decide that they will just do their own thing and go up privately. So we determined that we would look and see how things play out with an extended service, an extended hour service, and then we will proceed to the 24-hour service accordingly. And that is still in train. Remember that the reason why we were not able to do both polyclinics was because we had human resource issues, and we have some nurses from Ghana that are earmarked to augment the existing service at the polyclinic in St. John. And I believe that over time that we will be able to get to the 24-hour service in St. John, which is expected to cater particularly for St. John, St. George, St. Joseph, St. Andrew. The gym at St. John, when I became Minister of Health and Wellness and I toured that facility, I saw an excellent gym, but it was not being used. Excellent equipment. When I investigated this matter, I discovered that I think it was the Heart and Stroke Foundation was supposed to have utilized the gym in terms of treatment for persons requiring physical exercise and activity, but that really has not happened. And I have had some discussions within the ministry because I think in our efforts to promote healthy lifestyle and to try to deal with the obesity in the country and to get people active, that the facility at St. John should be made available under some arrangement to the people of St. John. And that is something that we will be pursuing going forward.
Just one final question, Minister. The David Thompson complex, are there any plans in place or coming and naming the actual polyclinic? Because we have a couple of outstanding healthcare individuals coming from St. John. Is there any possibility that we can, at some point in time, rename the polyclinic, not the complex?
Thank you, Honorable Member. A lot of people in Barbados really do not recognize that this facility houses more than the polyclinic. I think there's the welfare office, there's a welfare office there, there's a library, and one or two other entities. And so the facility is the David Thompson Health and Social Services Complex. The polyclinic is located within that complex. It is causing some problems, I would admit, because even with among my staff, people sometimes don't know what to call the polyclinic. Is it David Thompson? They say St. John. It is a bit of confusion, and I believe that some consideration ought to be given to having the polyclinic, not renamed, given a name, and recognizing that the polyclinic is located within the David Thompson Health and Social Services Complex. So that is something that can be considered.
Honorable Minister, I heard you talking about nurses we brought over to service well, it's not full 24-hour. Is there still room for nurses to get placement? Why I actually have a constituent that has been applying before our administration, really, up to last year, and has heard nothing, and she's qualified probably more than I am. Is there still room for hiring?
I can say that, well, the ministry and the minister certainly doesn't, the minister does not deal with hiring and so on, but I can say to you that, as I believe the executive chair of the QEH would have indicated last week, and I would have done so too, that there have been local nurses, qualified registered nurses who have been employed within the healthcare system within the last few months. And as long as people apply, we have there's a need for us to be able to satisfy the local demand. And as long as we have that demand, we will satisfy that demand. So I think I can say that once there are posts available, that yes, people can apply.
Thank you. Honorable Member for St. Thomas.
I would just like, ma'am, to congratulate the team here from the Ministry of Health under the astute leadership of the Honorable Member for the City, and to put in my 5 cents worth to make the query in relation to the elderly, in light that our numbers are growing extremely large every day. And we have started, yes, to put plans in place, but like anything else, it takes time, and we still have to do our statistics and put out our social workers and others to be able to bring in the necessary information as we shape the policy going forward. Our people are living longer, as everybody else knows, but the diseases that impact on many of them with the dementia and the Alzheimer's and so, it's even starting at an earlier age as far as we are picking it up. And I would like to know what plans there are, particularly with the Ministry of Education and the Ministry of Health, in looking towards the National Development Scholarship, facilitating more gerontologists to be able to work with the aged. A lot of families are out to sea when it comes to knowing and understanding how to treat the families, and the majority of them are those who are in the vulnerable sector. And therefore, I think it is time that we really more seriously look at those persons who will be trained in the area to help to facilitate, because as you know, ma'am, in your profession, this whole area of aging or the elderly is an extremely costly exercise if we are to really treat to the elder persons in our communities. And I would like to at least hear some of what the plans are in this respect as we go forward.
Thank you, Honorable Member. There's not much that I'm going to say on that at this point in time, because except to recognize, I acknowledge that there's a need for a comprehensive review of the elderly care facilities, structures that we have available, and also strategy based on the exactly what you said in terms of the aging population and the human resource capacity that we have available. What I can say is that within the geriatric system, I have seen some excellent care being given by caregivers, by nurses, and I believe that we can do better in terms of improving the facilities and obviously increasing the facilities. But as I said earlier, the community program, I think, is perhaps the key initiative in this regard. And I also believe strongly that we need to engage the private sector, because I think the time has come where we have to start looking at their care facilities for the elderly in order to help improve the quality of life for the elderly and also productivity in this country, because there are people who have to spend a lot of time caring for their elderly relatives. And if there was a facility where people can go to work and then return and pick them up, I think that that will go a long way towards improving their quality of life and productivity in this country.
Thank you very much, Minister. I agree with you wholeheartedly, because there's still a lot of wonderful persons, both men and women, in our numerous communities across Barbados who look out for the elderly, and they get nothing. They do it as a service, as most Barbadians are very hospitable and want to be able to share, because they would have grown up in the villages, and the same seniors would have worked with them to help them to be able to achieve. So I agree with you on what you've said in that respect, and of course in the daycare facilities for the aged, acknowledging that before the 1960s, our women had to find ways of having their babies kept. And we had a whole set of activities engaging private sector and others to build their nurseries for babies. Now that we have achieved the largest population of children, we need to now start refocusing our needs, as our ministry is doing now in the MPEA, to be able to cater for the aged. But it is not a single entity like ours in the Ministry of People Empowerment and Affairs that can do that. We really will rely on all the other agencies to come on board, particularly the Ministry of Health. And it brings me to the next query in relation to those elderly persons who occupy those critical bed spaces at the Queen Elizabeth Hospital and the alternative care program, and that we see every day the need for the expansion, and for us in the MPEA to be able to have more of our people put into the system. And one will appreciate there are hard times, and have always been hard times with poor people. And a lot of those who may be currently in the hospitals occupying these critical beds, I think it's about $25,000 a year to facilitate them. That is my idea, my figure in my head. And you look at what will happen in the alternative care program, that is so much less. And the district hospitals, which continue to do an excellent job, and I heard what the Honourable Minister said earlier, I would like to know how we would be able to work to help those very poor persons. We've got some social workers, we've got the National Assistance Board, and they bring in some reports. Every day, reports come to us, the Permanent Secretary, myself, others, wherever you go, for senior citizens who are suffering and need to be in care. But if I'm working for $350 a week, and my old grandmother, or my mother who had 2 strokes and can't work, or granddad who, for whatever reason, is now unable to help himself, how can I look after my parents? So when they go to the hospital, that's what I'm picking up. They go to the hospital, and they have amputations, they've had these strokes, they're unable to help themselves. Families cannot go back, much as we would love them to. And I'm making a case because it is a reality we are facing. How can we then, I can't say how can we, but those persons are expected to come and say, take home your mother, the discharge is here. But then when they get to the old house, the floorboard is no good. They can't be wheeling around in a wheelchair because of the condition of the house. There's nobody to give them a meal at 11 o'clock or whatever time, and they too are suffering from the chronic, from the non-communicable diseases. So it is a holistic approach that we now have to look at, and it is critical that all of us come together in the various social agencies to see how we can map out in the plans that we're working with to be able to go forward. And so I would like to know about the alternative care, because when they come to us, the MPEA can do nothing except report it to the Ministry of Health, because we are partners, yes, but we don't have that measure of authority, even though we are seeing it every day. And it becomes even a personal challenge for us, because we are pushing so far, but can go no further. Meantime, those who are disabled, those who are critically ill, are not getting the care that is necessary, because the private sector too does not have enough space to facilitate. So the Honourable Minister is correct. So I would just want to know what is the thinking in the plans for the budget for this year, how we can start to continue to work and have our synergies to be able to cater to that critical area of elderly in the country. Thank you.
Thank you, Honourable Member. The situation with elderly care in Barbados has to be viewed in a holistic manner. And I say that because I believe that there are a number of elderly persons within the district hospitals who do not necessarily require hospitalization. But hospitalization, in a lot of cases, is the only alternative because there are some things that we just do not have. Similarly, I do believe that there are a lot of people occupying beds, and they can be advised on this one, who would better be in a rehabilitation center if we had a national rehabilitation center, and that would also create some bed space. I think the discussion must be had in relation to elderly care, marrying hospitalization or medical care with social care. And that distinction, I think, has to be, I think we have to create a nexus that will allow us to be able to provide the best possible care, whether it is health care or social care. We have to do a lot more, as I indicated, in terms of engaging communities with community health care. And I believe if we had, I know at the St. Michael District Hospital, there was a small their care center there for the elderly. And I visited that facility on a number of occasions, and I saw people, elderly people who were actively engaged and really enjoying themselves. And that made me realize beyond a shadow of a doubt that we have to expand that kind of a service in this country. And I think that that will go a long way to alleviate some of the pressures which you are speaking about, Honourable Member. And finally, in the 2 years almost now that I've been Minister of Health and Wellness, I recognize the fact that we need, as a society, as a ministry, including the associations, the NGOs, to do a lot more to sensitize Barbadians about dementia and how to handle and deal with family members who are suffering with dementia. And I believe in a lot of cases that is why sometimes people appear to be abandoned. But I think it is a very challenging situation when you are at work or have to work, and you have to take care of your children, you have to take care of your elderly parents and relatives, and that is something I think that we need to discuss.
Honourable Member for St. George North.
Thank you, Madam Chair. I too would want to compliment the government and the ministry for doing an excellent job so far since we became the government almost 2 years ago. When I visited the hospital some time ago, I can see severe improvements. I like the idea of the 24-hour polyclinic initiative. And I believe generally, Barbadians feel a sense of hope about our health service. So I want to compliment the minister. But I want to ask the minister, where are we on the idea of a national health service? Because when you look at the polyclinics and the hospital, I believe that we are providing almost a national health service. The question is, though, I think we are still operating way behind in some modern jurisdiction where record keeping is concerned. I believe that every Barbadian should be issued with a health card so that you can monitor how you are performing in terms of person moving from the hospital to the polyclinics and vice versa. That you are spending a lot of money in drugs for persons repeat going to the polyclinic and then going to the hospital and vice versa. If you have record keeping, proper record keeping, then persons will be able to, your doctors will be able to see the records, persons will be identified based on their ID and based on other things which hospitals usually use. And I have made the point over and over again in this parliament that every Barbadian should be issued with that health card so that you don't have duplication of efforts. At the hospital, you may have one person who is James Brown. You may have another James Brown. So so that record keeping must be something that the hospital, the new initiative. I heard the director mention that there's a new initiative coming, new initiative for the new year. But I specifically asked this question because I think, and I know, that if you have proper record keeping, like a card should not be too expensive, you will be able to monitor how one person can be going from St. John Polyclinic and St. George and then the hospital, so that the duplication of thing, and you're wasting a lot of money at the hospital because of this whole idea of the record keeping is very, very poor. So I would like to see a new initiative. And I have asked this question before, and I don't know where the hospital is on this matter. That's my first question.
The hospital currently has very fragmented information systems. So there has been a need for a holistic information system, as you say, that will capture data and be able to track patients. So one of the things I mentioned a few moments ago is that we are introducing an integrated hospital information system that will track everything from beds to medication on a per patient basis. That will treat with what is happening within the hospital. I think you're also asking, Honorable Member, through the chair, about the broader issue of a national system that would track persons, not just within the hospital system, but across the entire apparatus through a health insurance or a health insurance card. I'll let the minister speak more broadly to that, but as I understand it, the hospital is going to be a unit or a node or a hub within this broader system, and the government in its midst and integrated information digitization efforts nationally are really working towards strengthening the national cybersecurity and information system infrastructure to be able to provide the underlying network systems that will create exactly what it is you're talking about. What we're doing at the hospital is equipping ourselves to be better able to manage, and we're already making the business case that tells us that if we introduce an internal information system that integrates finances with care delivery, that we're already standing to save significantly in terms of service delivery. So they're two separate but related things. And my understanding is that the Ministry of Information is working out on building a national cybersecurity and other infrastructure to enable exactly what you're talking about.
Honorable member, thank you. The acting CMO will speak shortly, but I just want to say something in relation to a statement which you made. I would say to the honorable member that I agree with you that our record-keeping systems may be antiquated, but they work. They work. It can be done more efficiently if we computerize or digitize whatever the systems. And within the polyclinics, that has already happened.
Right.
The only issue is that we didn't have an integration, or we have not been able to integrate with the QEH, and that is an initiative that is in progress,
Right.
as directed by the Honorable Prime Minister, but I'll let the CMO
I like that
respond
idea.
to you.
I really like that idea, integration.
Madam Chair, if I may add to the discussion at this point, we're 6 years into having a health information system in the public sector known as MedData. And the purpose of introducing MedData was to move from the, what I would call the more analog or antiquated way of keeping medical records and have a more electronic system of keeping records. And the benefits are increased effectiveness of what it is you're doing, increased efficiency, and most importantly, to enhance the quality of the delivery of healthcare services nationally. The system is not implemented fully at the Queen Elizabeth Hospital. However, please appreciate that systems can speak. So the integration from my perspective can happen at a very technical level, where even though you have two different systems, they can be integrated in a way that allows them to speak, and that would help for say, discharges. So you have somebody that's admitted to hospital that needs to be followed up in the public sector. The healthcare providers in the public sector will know that this person was admitted into hospital. This is what is expected on our end, so there's continuity of care. So just to add to the discussion. And then, of course, all of this is going to be subsumed under a larger effort to improve digital capacity and capacity of information technology nationally.
Yeah, I also want to find out from the minister, to what extent are you working with the other Department of the Environment and other ministries to sensitize workers? Because today we have a number of workers coming down sick because of this sick building syndrome. And it is a big problem. I know it is not your ministry, but I want to find out to what extent are you working, because almost every day you hear that workers are going off sick because they're not comfortable. And it seemed to me that this sick building syndrome is a problem in Barbados today. And it is costing government a lot of money, I can imagine. How are you sensitizing the other department and government to see how workers can be more comfortable and vice versa? How are you really helping in this process?
Thank you, honorable member. I'm sure that you would appreciate that the Ministry of Health and Wellness has a responsibility for the health and wellness of the workers and the entire population. But the issue is the buildings. And I can say to you that our environmental department has been working with the Ministry of the Environment and others, because we have sometimes to engage people who specialize in air quality and so on. And we do that, we collaborate, but the direct responsibility for that does not rest with the Ministry of Health and Wellness.
Minister, can the Ministry of Health request that or order that a building be closed on your side because of suspected building syndrome? I know the Ministry of Health does the testing in most cases and report, well, health/environment. Do y'all have the power to do that? Because I have to thank the honorable member for St. George North. This is something that is increasing in Barbados. We might not have documentation in all the cases, but the anecdotal evidence is there for issues with sick building syndrome. What is the plan going forward?
I cannot speak to the plan, but I will ask the Chief Environmental Health Officer to respond as best as she can in relation to the questions that have been posed. Ms. Francine Bascom.
Good afternoon. Ministry of Health, our regulations does not speak to us being able to close a building because of it being a sick building syndrome.
Well, let me put it this way. Buildings that are contaminated with fungi and bacteria, etc. Let's not call it sick building syndrome. Just like how you can shut down a restaurant for contaminated kitchens.
Slightly different regulation, ma'am. But we go in and we do our inspections and we can make recommendations in terms of the cleaning of the building, addressing whatever the issue is. So I guess in that way, yes, you can say the building would be, if it requires to be closed for that process to be done. But in terms of a regulation that says we can go in to do that, we don't have any such regulation at this point in time. And it is a mixture between us and Ministry of Labor and the Environmental Protection Department.
Anyway, I want to just share with the minister one suggestion. I dreamt recently that all the air conditions of all the buildings were taken out, and that we had a free society where there's only ventilation with windows. And I wonder, and in that society, workers who go home don't become sick. When you're home, you don't be sick because you have your windows open. Once you come to work, because of the air conditioning, you become sick. And I just want you to think about it. You don't have the answer, but I just want you to think about that particular dream that I had. My final question, though, Minister.
And then you woke up and realized that you were only dreaming on a number.
I really thought I was only dreaming. My final question, Minister, has to do with my constituency, Lower State Quarry. And my constituents are still worried that the Lower State Quarry, I understand that you visited and the residents are very happy that you visited, but they claim that there are continued activities at the quarry. And I want to ask you, through the environmental department, what is really happening? Can you tell us so that they can be happy and sleep better tonight by hearing you? Because I'm sure that they're listening to this program.
Let me respond first. From the time the residents of Lower State engaged the Ministry of Health and Wellness on this matter, I took an active interest in it. And as you said, I actually visited the quarry with residents. We had some meetings at the Ministry of Health and Wellness. I indicated then the action that we were going to take, which is to engage all of the stakeholders because this is a long outstanding matter. That was done, and they were invited to participate in that process. A paper was taken to Cabinet on the matter involving not only Lower Estate, but other similar facilities. And Cabinet approved the recommendations that were made in the paper, including the establishment of a technical committee for which I have responsibility. This is an inter-ministerial committee and technical committee. And 2 residents of the association also were invited to sit on this committee.
True.
That committee has started to do its work. And I recall, I think it was on the 31st, all years there. Yeah. At 6 p.m. or so in the evening or 7 o'clock, I was asked to come, and the chief medical officer and myself met with residents.
Yes.
And we explained what was going to happen and the action to be taken. And I know that committee has been meeting and have been engaging the residents, and things have been happening. In relation to whether or not the quarry is still being used, I certainly am. I am aware of one incident which was reported to me directly by a resident, but I'm not certain as to what is happening at this time.
Okay, thank you.
Honorable Member for St. James South.
Thank you, Madam Chair. And I want to support the comments made by the Honourable Member for St. Thomas and the Honourable Member for the City in relation to the issue of elder care, because in St. James South, I have an aging population. I have residential areas that have very few young children. I have people who are retired, I have people who are seniors, and over the years, I've seen the inability of the individual sometimes maybe to cope if there's dementia or if there's immobility, or where sometimes families are just not able to cope. And therefore, I am really looking forward that as a government, when we work together to create a holistic plan to deal with this crisis, because it is critical that we get our arms around it and help the society to adjust. One of the things I believe strongly, I'd started an elder care program in my constituency, and I remember I went just to open the session. But what the lady shared kept me gripped to my seat, and I had to call and tell who was waiting on me, I cannot come, I have to hear this. And I went to the entire program. And I came to the conclusion that every single family, because every single family member will become elderly, every single family member needs to understand about elder care. It made a tremendous difference to how I engage the elderly in my family, because I then understood better. And I really want to recommend that somehow we get something like that happening. But my main question has to do with what you had started to allude to. I know that your ministry has been liaising with the Ministry of Foreign Affairs and Foreign Trade over the CARICOM program about wellness and COSOD, and how we're going to link trade and health, and that right now, the COTED and COSOD are looking at what needs to be done in terms of controlling the things that are imported into the country that may be injurious to health, and how we can better use the COTED to help manage what people are consuming. I just wanted to get an update on where we are with that, but on a broader note, our National Nutrition Program, because prevention is going to be where it is at for us. And I just wanted to get a full understanding of what we're doing or what we will be doing in the future towards this.
Thank you, Honourable Member. Thanks for the question. I'm going to invite Dr. Arthur Phillips, who's the Senior Medical Officer of Health with responsibility for NCDs, to be able to respond to your questions.
Thank you, Madam Chair. A couple issues. The Ministry of Health is actively engaged in relation to the continuation of the discussion coming out of the joint COTED, COSOD, Trade and Health meeting on NCDs, which was a special meeting. We don't often have meetings in which we discuss trade and health and NCDs, particularly in that context. And we were very happy to be able to collaborate with our colleagues in international trade and for the insight and support that they gave us in that effort. Most recently, there would have been some communication between Ministry of Health and Foreign Trade in relation to Barbados's representation on committees coming out of that, and Ministry of Health has nominated my post to sit on the two committees that will be looking at the issues and advising on the regional approach to these issues in terms of alcohol and nutrition in particular. On the issue of the importation of foods that are injurious, that is work that has the attention of our National Nutrition Program, and we will, through the appropriate channels, be sharing documentation on our suggestions of items to be considered. Yeah, we are fortunate to have the NCD Commission as well as the Cabinet the National Task Force on Wellness, as well as the Cabinet Subcommittee on NCDs. And again, international trade would have been included in that cabinet subcommittee following our discussions. The National Nutrition Program, Minister would have mentioned the nutrition policy that we're working on in collaboration with PAHO. And in particular, we are looking to, in the first instance, put together the elements in relation to school-age individuals in collaboration with Ministry of Education, PAHO. So that work is underway. And the piece that comes after that is particularly in relation to government food service departments and the guidelines and policy that will govern that. And again, we're collaborating with the Pan American Health Organization on that. So we think it's important that the collaboration continue. The reality is that individuals will eat the things that they find are attractive and that are available. Yes, that are affordable. And therefore, as a government, we have a responsibility to look at issues around labeling, to look at issues around availability and pricing as we seek to support the population in having access to foods that are useful